Christina, thank you. The World Health Organization has declared Mpox a new global health emergency.
Yeah, this is cases of the virus spread in parts of the world. Dr. Richard Chaffoo is joining us now to talk more about this. Let's really get into this for a second. For a lot of people, what is Mpox?
So, Phil, Mpox is actually a virus. It's similar, it's part of that, very similar to smallpox as a virus. So it's something that's endemic or natural in Central and Western Africa, and it's found more in rats and rodents, in primates other than humans, like in monkeys. And typically what happens in these types of situations is someone may have come in close contact with an animal that has this, or another person. There may have been a bite from an animal. They may have eaten, contaminated meat, and then they can get the symptoms of Mpox.
Speaking of symptoms, what are they?
So they're a broad range of symptoms, Maria. You can oftentimes you can have a fever. You can have a rash, swollen lymph glands, headaches, chills, muscle aches, backache, just tens of tiredness, overall generalized fatigue. And the rash is rather specific because it typically begins on the peripheral areas. It may be on the hands, maybe on the face, the feet. And then the rash initially starts as a red flat area, and then it can form a blister, and then it can get infected, look yellow, purulent-like material, and then burst.
So
okay.
Let's talk. That's
Sorry,
so pleasant. Sorry,
like, wow.
people, it's lunchtime. I know. Yeah, we're not showing you pictures, but no. you sort of touched on this a little bit. So how does it spread? Is it person to person? I mean,
so Phil, it can spread person to person. Yes, if that bursts, then certainly, or if you're, there are bed sheets or clothing or something. Close contact. It's not past respiratory, so it's either direct contact or being bitten by an animal, close contact with an animal. Those are the most common ways to.
Dr. Chaffoo, what can we do to really just stay away from it or keep ourselves from getting it?
Well, I think the big thing, Maria, is a heightened sense of awareness. Number one, I think this is great to at least alert people. There have been a few isolated cases in California. Most of the time you'll get this from international travel, or you may have eaten meat that had this in it. It's not like it's an epidemic here in the United States, but it's a really good idea for people to always stay in contact with CDC. The CDC is a great resource for all of us. It's a government-authorized website that will keep us up to date about, and tracks diseases state to state and region to region. So it's really very helpful, useful information.
How do you treat Mpox?
So, unfortunately, there's no specific antiviral medication for it. There are a couple of the smallpox vaccines that may provide immunity, but it's really supportive care. You want to make sure they're well hydrated. If they have these rashes, you want to keep them covered. Obviously, keeping someone like that away from other people. If you're in contact with someone like that, washing your hands with warm water and soap. Just using those sorts of common sense precautions.
What are the complications if you do happen to get it?
So there can be complications. They can be, you can get scarring from the rash, you can have visual problems, blindness. Death is reported in certain cases. Fortunately, the strains that we have here in the U.S. don't seem to cause mortality in people, but they can be quite severe. There are cases where they might give what are called immunoglobulins, which are given to people. And there are some antiviral agents that may be used, but really there's no specific vaccine for it, nor is there a specific antiviral drug that will eliminate it. You just need to have a heightened sense of awareness. If you see something that seems unusual, if you, for example, notice you have a rash, you have an unexplained fever, a lot of fatigue, weakness, you just want to think, well, there may be something going on, that needs to see the doctor. Not that every rash is Mpox.
Right.
We don't want to, they're
and
not.
It's very specific as to how it starts. Like you said, it starts in like your extremities.
Correct.
And then turns into.
But the important thing I think for the public to take away is that not, common things are common, as we say in medicine, but then there are some uncommon things that look common. So if something, your symptoms are not getting better, they're getting worse, it's time to get in to see your physician, to get evaluated, get worked up. Because if you have obviously an illness like this, it's like anything else. You want to treat it very early on.
And you might want to call ahead of time and let them know that
let them-
that's something
no
you
surprises.
suspect.
No surprises, exactly.
Yeah,
Yes.
don't head in there.
Yeah.
You
All right,
might
Dr.
spread it
Chaffoo,
everywhere.
thank you so much for joining us. I'm glad we didn't have any visuals.